Falls can happen in a single moment, but the small habits that increase your risk often build up quietly over months or even years. If you're over the age of 65, you may believe that losing your balance is simply part of getting older. But what if some of the biggest reasons people fall have nothing to do with age itself? What if they're everyday mistakes that many older adults make without realizing it? Today's video could help you spot those hidden risks before they lead to a serious injury. We'll walk through 7 common balance mistakes that may increase your chance of falling, explain why they matter, and share simple changes that could help you move with greater confidence. And be sure to stay until the end, because the final mistake is one that even active, healthy seniors often overlook. It may seem harmless, but it can quietly affect your stability every single day. As always, this video is for education and isn't a substitute for personal medical care. If you've had recent falls, feel dizzy often, or notice sudden changes in your balance, it's important to speak with your healthcare provider for a proper evaluation. Let's begin. Many people think balance is something you're either born with or gradually lose as the years go by. In reality, balance is more like a team effort. Your muscles, joints, eyes, inner ears, nerves, and brain all work together every second you're standing or walking. If just one part of that team isn't doing its job well, your risk of falling can increase. The encouraging news is that many balance problems are linked to daily habits that can be improved. Even small changes, practiced consistently, may strengthen your stability and help you stay independent longer. Imagine getting up from your favorite chair, walking to the kitchen, or stepping outside to collect the mail. These simple tasks feel automatic until balance becomes less reliable. A single fall can lead to bruises, broken bones, fear of moving, and sometimes a loss of confidence that lasts much longer than the injury itself. That's why understanding these common mistakes is so valuable. Instead of waiting until after a fall, you can take steps now to reduce your risk. And as we continue, you'll discover that some of these mistakes have surprisingly simple solutions. Let's start with mistake number 7. Mistake number 7 is relying on your arms instead of your legs every time you stand up. Have you noticed yourself pushing hard on the armrests of a chair? Maybe you grab the table or use both hands to pull yourself upright every single time. It feels easier in the moment, so most people never question it. The problem is that your leg muscles gradually stop doing as much of the work. Like any muscle in the body, when they're used less, they become weaker over time. Your thighs, hips, and core muscles are especially important for balance. Every time you rise from a chair, they receive a chance to stay strong. But if your arms do most of the lifting day after day, those muscles don't get the same opportunity. Think of it like riding a bicycle that always has someone pushing from behind. Eventually, your own legs don't have to work as hard. The same thing can happen with standing up. This doesn't mean you should stop using your hands if you truly need them. Safety always comes first. If using the armrest prevents a fall, continue doing so while working with your healthcare provider or physical therapist on strengthening exercises. However, if you can safely practice standing with less support, even a few times each day, your muscles receive an important reminder to stay active. Start slowly. Scoot toward the edge of the chair. Place your feet firmly beneath you. Lean your upper body slightly forward and let your legs do as much of the work as they comfortably can. Many physical therapists recommend repeated sit-to-stand exercises because they strengthen muscles that are essential for everyday independence. It's one of the most practical movements you can practice because it directly matches a task you perform many times every day. One viewer might think, I only use my hands because I'm careful. That's understandable. But it's worth asking yourself whether you're helping your balance or quietly allowing your muscles to become less capable over time. Another helpful tip is choosing chairs with a comfortable height. Very low sofas may look inviting, but they require much more leg strength to stand up from. If you often struggle getting out of one particular chair, the furniture, not just your body, may be part of the problem. As we move to the next mistake, you'll see that muscles are only one piece of the balance puzzle. Your eyes also play a much bigger role than many people realize. Mistake number 6 is depending too much on your vision while forgetting to train your body's natural balance system. Most of us don't think about how much we rely on our eyesight to stay upright. Yet every step you take depends on information coming from your eyes, your inner ears, and special sensors in your muscles and joints that tell your brain where your body is in space. When one of these systems becomes weaker, the others try to make up for it. That works well for a while. But if you depend almost entirely on your eyes, you may notice problems when lighting changes. Have you ever felt less steady walking to the bathroom during the night? Or perhaps you've stepped into a dim parking lot and suddenly felt uncertain about your footing. That's because your brain has less visual information to work with. If your muscles and inner ear aren't well trained, balance becomes more difficult. An easy way to understand this is to imagine standing on a boat. When you can clearly see the horizon, staying balanced feels easier. But if thick fog suddenly rolls in, your body has to depend much more on other balance signals. Fortunately, there are simple ways to keep these systems active. For example, safe balance exercises recommended by a healthcare professional or physical therapist may involve standing near a sturdy counter while gently shifting your weight from one foot to the other. Others may include controlled heel-to-toe walking or carefully practicing standing with a narrower stance while holding on for support. These exercises help your brain become better at combining information from your eyes, muscles, and inner ears. Over time, that teamwork can improve confidence during everyday activities. Your eyesight deserves attention too. Regular eye examinations are important because updated glasses and early treatment for vision problems may reduce fall risk. Even something as simple as improving lighting in hallways, staircases, and bathrooms can make a meaningful difference. If you wear glasses with multifocal lenses, take extra care on stairs or uneven ground. Some people find it harder to judge steps while wearing certain lenses, and your eye care professional can advise you about the safest option for your needs. Another often overlooked habit is rushing through dark rooms without turning on the lights. Saving a few seconds isn't worth increasing your chance of a serious fall. So far, we've looked at muscle strength and vision, but the next mistake surprises many people because it begins long before you even stand up. In the next section, we'll explore a daily habit that can quietly affect your blood pressure, your balance, and even the way your brain responds when you first get on your feet. One daily habit that often goes unnoticed is standing up too quickly after sitting or lying down. It may seem like a small thing, but for many adults over 65, this simple movement can become a hidden trigger for dizziness and falls. Mistake number 5 is rushing to your feet without giving your body time to adjust. Have you ever stood up from bed in the morning and felt the room spin for a few seconds? Or perhaps you've gotten out of your favorite chair only to feel lightheaded before your balance returned. If so, you're not alone. As we age, our bodies may take a little longer to adjust blood pressure when we change positions. Normally, when you stand, gravity pulls some blood toward your legs. Your heart and blood vessels quickly respond by keeping enough blood flowing to your brain. Sometimes that response isn't as fast as it used to be. The result can be a brief drop in blood pressure, causing dizziness, blurred vision, or a feeling that you might faint. Doctors call this orthostatic hypotension. That's a complicated name for a simple idea. Your blood pressure falls when you stand up. It becomes more common with age and may also be affected by dehydration, certain medications, diabetes, heart conditions, or long periods of bed rest. That's why it's important not to ignore repeated episodes. Imagine waking up during the night to use the bathroom. You're still sleepy, the room is dark, and you quickly swing your legs over the side of the bed before standing. Everything feels normal for a moment. Then suddenly, you feel unsteady. Those few seconds are when many falls happen. Fortunately, a small change in routine can make a big difference. Before standing, sit on the edge of the bed for a few moments. Wiggle your feet, gently tighten your calf muscles, and take a slow breath. Then stand up gradually instead of all at once. Once you're standing, pause before you begin walking. Give your body a chance to catch up. This simple habit may only take 10 or 15 seconds, but those seconds can be well spent, especially if they've helped you avoid a fall. Hydration also matters more than many people realize. Even mild dehydration can make blood pressure problems worse. Many older adults drink less water because they worry about frequent trips to the bathroom. Others simply don't feel thirsty as often as they did when they were younger. Unless your healthcare provider has told you to limit fluids because of a medical condition such as heart or kidney disease, staying well hydrated supports many body functions, including healthy circulation. If you've started a new medication and suddenly notice dizziness when standing, don't assume it's just aging. Some blood pressure medicines, sleep medications, antidepressants, and other prescriptions may contribute to this symptom. Never stop a medication on your own. Instead, speak with a healthcare professional who prescribed it. Sometimes adjusting the dose, changing the timing, or switching medications can help while still treating the original condition. Here's another important point. If dizziness lasts longer than a few seconds, happens frequently, causes fainting, or comes with chest pain, severe headache, weakness, or trouble speaking, seek medical attention right away. Those symptoms need prompt evaluation. The good news is that many people reduce these dizzy spells simply by slowing down and paying attention to how their bodies respond. It's a reminder that balance isn't only about muscles, it's also about circulation and giving your body the time it needs. Now, you might think the next mistake is about exercise. Surprisingly, it often happens while you're standing completely still, and that's exactly why so many people miss it. Mistake number 4 is avoiding single-leg balance practice because it feels uncomfortable. Think about how often everyday life asks you to stand on one leg. Every time you climb stairs, step into a bathtub, put on your pants, or reach for something while walking, one leg briefly carries most of your weight. Many people stop practicing this natural skill without even realizing it. Perhaps you've started sitting down to put on your shoes because it feels easier. Maybe you avoid stepping over curbs unless you can hold on to something. There's absolutely nothing wrong with choosing the safer option when needed. But if your body never practices balancing on one leg, that ability gradually fades. Balance works much like learning a language. If you stop using it, you become less fluent. The encouraging news is that balance can often improve with regular practice, even later in life. That doesn't mean trying risky exercises in the middle of the room. Safety always comes first. One simple exercise recommended by many physical therapists is standing behind a sturdy kitchen counter. Hold the counter with both hands and slowly lift one foot just an inch or two off the floor. Stay there for a few seconds if you feel steady. Then place your foot back down and repeat with the other side. Over time, as advised by your healthcare provider or therapist, you may gradually increase the time. The goal isn't to challenge yourself until you almost fall. The goal is to teach your brain, muscles, and joints to communicate more effectively. Remember, quality matters more than difficulty. A few minutes of safe practice several days each week is often more valuable than trying something advanced once in a while. Another helpful activity is Tai Chi. This gentle form of movement combines slow, controlled motions with weight shifting and posture awareness. Research has shown that Tai Chi can improve balance and reduce fall risk for many older adults when practiced consistently. It's also easy on the joints and can be adapted for different ability levels. Walking is excellent for heart health and overall fitness. But walking alone doesn't fully train balance. Think of it this way. Walking mostly moves you forward in a straight line. Daily life is different. You turn suddenly to answer the phone. You step sideways to avoid a pet. You reach into a cabinet. You pivot while carrying groceries. These movements challenge your balance in ways that ordinary walking may not. That's why adding a few dedicated balance exercises to your routine can complement the walking you're already doing. And here's something many people find encouraging. Small improvements often build quietly. You may not notice much after 1 week, but after several weeks of consistent practice, getting dressed, climbing stairs, or walking across the yard may begin to feel more confident. We're halfway through our countdown now. The remaining 3 mistakes are even more important because they involve habits that many healthy, active seniors make every single day without realizing how much they affect stability. The next one is especially surprising. It isn't about how strong your muscles are or how often you exercise. Instead, it's about something attached to your feet every single day, and it may be increasing your fall risk far more than you think. Mistake number 3 is wearing the wrong shoes for balance. It might seem hard to believe that something as ordinary as footwear could affect your risk of falling, but the shoes you wear create the only connection between your body and the ground. Every step you take depends on that connection. Many older adults continue wearing shoes because they're comfortable, familiar, or easy to slip on. Unfortunately, comfort doesn't always mean stability. Think about a pair of worn-out slippers with soft, smooth soles. They may feel cozy around the house, but they often provide very little grip on hardwood, tile, or laminate flooring. Now imagine walking across the kitchen carrying a cup of coffee. You turn slightly, your foot slides just a little, and suddenly your balance is gone. It doesn't take a dramatic accident. A slip of only a few inches can be enough to cause a serious fall. Another common problem is wearing shoes that are too loose. If your heel lifts every time you take a step, your foot has to work harder to stay stable. That extra movement may seem minor, but over hundreds or even thousands of steps each day, it can affect your balance. On the other hand, shoes that are too tight create different problems. They may cause foot pain, numbness, or changes in the way you walk. When your feet hurt, your body naturally changes its movement to avoid discomfort. Over time, that altered walking pattern can increase your chance of stumbling. Many experts recommend shoes that fit securely, have a firm heel, a non-slip sole, and enough room for your toes to move comfortably. They don't have to be expensive. The most important feature is that they support safe, steady movement. Here's another habit that surprises many people: walking around the house in socks alone. If you've ever stepped onto a polished floor wearing socks, you know how slippery they can be. Even socks with grip patterns on the bottom may wear out over time. If you prefer not to wear outdoor shoes indoors, consider supportive indoor footwear designed with non-slip soles. That simple change may reduce your risk without sacrificing comfort. Don't forget to inspect your shoes regularly. Take a look at the bottom of the soles. Are they worn smooth? Is one side more worn than the other? Uneven wear can sometimes signal changes in the way you walk, and it also reduces traction. Replacing worn shoes may be one of the simplest investments you can make in your safety. Foot health matters too. Conditions like bunions, arthritis, nerve damage from diabetes, or thick, painful toenails can all affect balance. If your feet hurt, you may unknowingly shorten your steps or shift your weight unevenly. That's why regular foot care is about much more than comfort. It's an important part of staying mobile and independent. If you have diabetes, checking your feet regularly becomes even more important. Reduced sensation means you may not notice small injuries that change the way you walk. A podiatrist, a healthcare professional who specializes in foot health, can often recommend treatments or footwear that better supports your balance. Now here's an interesting question. Have you ever noticed that you feel less steady when you're tired, even if you're wearing good shoes? That's because balance isn't only about your feet. It also depends on how well your brain pays attention to what's happening around you. And that brings us to mistake number 2, a habit that's become much more common in recent years. Mistake number 2 is trying to walk while distracted. Our brains are remarkable. They can manage many tasks at once. But as we grow older, dividing attention between several activities often becomes more difficult. Imagine walking through your living room while reading a text message, or carrying on an intense conversation while stepping over a rug. Your brain now has 2 jobs. One is controlling your movement. The other is processing information. Sometimes one task steals attention from the other. Researchers call this dual tasking. In simple terms, it means trying to think and move at the same time. For younger adults, this may not seem like a challenge, but for many older adults, dual tasking can slow reaction time and increase the chance of tripping. Picture someone carrying a basket of laundry down the hallway. They're thinking about dinner, listening to the television in another room, and trying to avoid the family dog lying on the floor. Nothing unusual is happening, yet their attention is divided in several directions at once. A small obstacle that would normally be easy to avoid suddenly becomes much harder to notice. The solution isn't to stop multitasking completely. Instead, it's to recognize when balance deserves your full attention. If you're walking on stairs, crossing a busy parking lot, stepping onto uneven ground, or getting out of the shower, give yourself permission to focus on that task alone. It may feel like a tiny change, but those few moments of focused attention can make a meaningful difference. Another common distraction is rushing. Many falls happen not because people are weak, but because they're in a hurry. The phone rings. The doorbell sounds. You suddenly remember something you forgot in another room. Without thinking, you speed up. Your steps become longer, your posture changes, and your attention shifts away from where your feet are landing. The truth is, very few things are so urgent that they're worth risking a fall. Let the phone ring. Take your time. Move with purpose instead of rushing. Many people find that slowing down by just a few seconds actually helps them complete tasks more safely and with greater confidence. There's another source of distraction that often goes unnoticed. Clutter. A stack of magazines, electrical cords, loose throw rugs, pet toys, or even a pair of shoes left in the hallway can become unexpected obstacles. Your brain has to constantly adjust to avoid them. Reducing clutter doesn't just make your home look tidier. It reduces the number of decisions your brain must make while walking, leaving more attention available for balance itself. We've now reached the final mistake, and it's the one many viewers least expect because it has nothing to do with exercise, shoes, or even paying attention. Instead, it involves a gradual change that often develops so slowly that people simply accept it as part of aging. But accepting it without evaluation could mean missing an opportunity to improve both your balance and your quality of life. Mistake number 1 is assuming balance problems are just part of getting older, instead of finding out what's really causing them. This may be the most important mistake of all. It's true that our bodies change with age. Muscles naturally become smaller if we don't use them. Our reaction time may slow a little, and our vision or hearing can change over the years. But frequent loss of balance is not something you should simply accept without asking why. Too often, older adults tell themselves, "I'm just getting older," after stumbling or feeling unsteady. Family members may even say the same thing. While aging can play a role, balance problems are often caused or made worse by conditions that can be identified and, in many cases, improved. For example, an inner ear problem can affect the way your brain senses movement. Since the inner ear acts like your body's natural balance center, even a small problem there can leave you feeling as though the room is spinning or that you're walking on a moving surface. Poor vision is another common factor. If cataracts, glaucoma, or changes in your eyeglass prescription make it harder to judge steps or see obstacles clearly, your risk of falling naturally increases. Regular eye exams become more important with age, not just for reading or driving, but for staying steady on your feet. Certain medications deserve attention as well. Some medicines can cause dizziness, drowsiness, blurred vision, or slower reaction times. This doesn't mean you should stop taking them on your own. Instead, if you've noticed changes in your balance after starting a new medication or after your dose was changed, talk with the healthcare professional who prescribed it. A medication review can sometimes reveal combinations or side effects that increase fall risk. Hearing changes may also play an unexpected role. Many people don't realize that hearing and balance are closely connected because the organs responsible for both are located within the inner ear. Treating hearing loss won't solve every balance problem, but for some people, better hearing can improve awareness of their surroundings and support safer movement. Another condition that deserves attention is nerve damage, especially in people living with diabetes. Healthy nerves send constant messages from your feet to your brain about where your body is positioned. If those signals become weaker, you may have trouble sensing the ground beneath you. Some people describe it as walking on thick carpet or wearing heavy socks all the time. If you've noticed numbness, tingling, burning sensations, or reduced feeling in your feet, don't ignore it. These symptoms deserve medical evaluation because they can affect both balance and overall foot health. Low vitamin levels, joint problems, heart conditions, dehydration, low blood pressure, and even poor sleep may also contribute to feeling unsteady. That's why it's important to look at the whole picture rather than assuming there's only one cause. A healthcare provider may recommend simple blood tests, a review of your medications, vision or hearing checks, or referral to a physical therapist who specializes in balance training. Many people are surprised to learn that physical therapists don't just help after an injury. They also help prevent injuries. They can evaluate how you walk, identify weak muscles, test your balance safely, and create exercises designed specifically for your needs. Those exercises are often gentle, practical, and focused on improving the movements you use every day. Standing from a chair, climbing stairs, turning around, reaching into cupboards, or stepping over obstacles. Perhaps the most important lesson is this: a fall is not an inevitable part of aging. While no one can eliminate every risk, many falls are preventable through a combination of healthy habits, regular medical care, strength and balance training, safe footwear, good lighting, and paying attention to changes in your body. Let's quickly review the 7 balance mistakes we've covered today. Number 7. Relying on your arms every time you stand, instead of keeping your leg muscles engaged whenever it's safe to do so. Number 6. Depending only on your eyesight while neglecting to strengthen your body's natural balance systems. Number 5. Standing up too quickly without giving your circulation enough time to adjust. Number 4. Avoiding safe balance practice because it feels uncomfortable or unnecessary. Number 3. Wearing footwear that doesn't provide the support and grip your feet need. Number 2. Walking while distracted, rushing, or trying to do too many things at once. And number 1, assuming balance problems are simply caused by aging instead of discussing persistent changes with a qualified healthcare professional. If there's one message to remember from today's video, it's this: balance isn't built by one big decision. It's built through dozens of small choices you make every day. The way you stand up, the shoes you wear, the attention you give to your surroundings, the exercises you practice, and your willingness to seek medical advice when something doesn't feel right. Those small choices can add up over time, helping you stay active, confident, and independent for years to come. Even if you've experienced a fall in the past, don't lose hope. Many people improve their strength and stability with consistent practice and the right support. Progress may come gradually, but every safer step is a step worth celebrating. Thank you for spending these minutes with us today. We hope this information helps you feel more confident and better prepared to protect your balance. Now we'd love to hear from you. How old are you, and which of these 7 balance mistakes surprised you the most? Have you found a daily habit or exercise that has helped you feel steadier on your feet? Please share your experience in the comments below. Your story may encourage someone else in our community who is facing the same challenge. If you found this video helpful, consider sharing it with a friend, spouse, sibling, or neighbor who wants to stay independent and reduce their risk of falling. Sometimes one simple conversation can make a meaningful difference. And if you're interested in practical, evidence-informed tips for healthy aging, brain health, heart health, mobility, nutrition, and living well after 60, be sure to join us again for future videos. Until next time, take care of yourself, keep moving safely, and remember that it's never too late to build better balance, one steady step at a time.